Hi, my name is ALYNA, and I'm your AI Learning Assistant. I want to welcome you to a demonstration of our provider training and patient consultation aesthetic software. But first, let's take a moment to think about the following question. What are prospective patients looking for when selecting their aesthetic medical provider? Research shows patients want experts who can make them look more naturally attractive. In other words, they want elite-level practitioners. It's widely accepted that experts invest the necessary time, money, and effort to master their aesthetic medical skills at an elite level. It doesn't happen after taking a single class, course, or hands-on training. It takes time, repetition, and an ongoing commitment to aesthetic excellence. This means it's crucial to show patients that you're an expert, elite practitioner that can achieve the best possible aesthetic goals for them in a clear and effective manner. So how can that be accomplished? The answer is by using our consultation software app to demonstrate real, effective aesthetic enhancements during the consultation. Before we start, let's examine the benefits of using our demonstrable aesthetic software. By showing planned aesthetic enhancements and their potential benefits to each patient, you increase consult closure rate, repeat treatments, and ultimately, revenue. Studies show that increasing repeat treatments by 5% boosts revenue by 25 to 30%. This means that you can increase revenue while standardizing and improving aesthetic outcomes, even in a practice that has multiple providers. This app is not only designed for patient consults, but also provides training for both new and existing aesthetic medical providers. With on-demand availability, you'll be able to save time and money, training providers and support staff. So what makes our patient consultation and provider training aesthetic app so effective? Like the rest of the ideal aesthetic medical training platform, it's based upon the proven sound beauty fundamentals of the PALMA Code. The PALMA Code beauty principles were created and successfully used by our founder and CEO, Francis R. Palmer III, MD. Recognized as one of the world's leading experts in beauty evaluation and enhancement, Dr. Palmer had an international practice as a Beverly Hills plastic and cosmetic surgeon for over 3 decades and was voted one of the world's best plastic surgeons by the international media. Applying the PALMA Code beauty principles, Dr. Palmer expertly improved the appearance of thousands of people from all around the globe, including celebrities, royalty, captains of industry, as well as everyday people from all walks of life, cultures, and socioeconomic backgrounds. This is why the PALMA Code beauty principles are the underlying focus of the consultation app and the aesthetic cornerstone of the ideal medical aesthetics training platform. Let me show you how it works. To begin a patient consultation or provider training session, you'll open up the application and select the patient's gender. For brevity's sake, we have selected a female. With the patient sitting beside you in front of the screen, a standard non-smiling image of a female is displayed. The patient is then asked to identify which features or areas of the face they wish to improve. Once the facial features are selected, you follow the evaluation and enhancement demonstration of each selected feature one by one. Beginning with the first selected feature or area of improvement, the patient is shown a selection of models. The patient is then asked to select one of the models that best represents the shape and size of the features they have. In other words, they look at the models and say, "Oh, I think my lips look like number 3 or number 2. You, as the consultant and provider, then help them make the most accurate selection. This engages the patient and establishes you as their expert aesthetic advisor. Once the selection is made, an injection pattern is displayed. This pattern represents the proposed treatment to achieve the ideal aesthetic outcome. In this case, it'll be for a dermal filler treatment, but the app also includes treatments using neurotoxins, skin resurfacing and rejuvenation, as well as tightening modalities. Next, the aesthetic outcome is displayed as well as a treatment plan. The treatment plan summarizes the before image, the treatment, and the after image showing the aesthetic improvement. The treatment summary can be saved and printed and used by the provider during the actual procedure to further support patient and/or provider education and training. It should be noted that displaying the proposed treatment plan vastly improves the patient's understanding of why a certain number of filler or neurotoxin syringes are being suggested. This effectively removes pushback from patients who expect a single syringe of dermal filler or 10 units of a neurotoxin to treat broad areas of the face. The treatment plan shows them immediately why that just doesn't make any practical sense, again supporting you as their expert aesthetic advisor. So now let's go ahead and launch the program to see how it works. After you've launched the program, you'll see a face displayed with a legend showing various features and facial areas based upon the Palmer Code beauty principles, intellectual property and patents. You'll be able to select, for example, enhance lips, and you see the lips highlighted. You can also select other areas to enhance, such as the cheeks, chin, jawline, as well as the option to reduce lines, wrinkles, or facial folds. You can also ask me at any point to show you specific information about relevant subtopics for targeted focus, or for clarification, education, and demonstration purposes. Let's begin by looking at enhancing the lips. As you can see, there are 6 models, but let's say our patient has identified model number 1 as the set of lips that most resembles her lips, so we'll click on her. On this screen, you get some basic information about what aesthetically ideally shaped lips look like, how to evaluate the lips, as well as a typical treatment demonstration video. This all occurs in real time for the prospective patient, enforcing the fact that you truly are an aesthetic medical expert. To proceed, you click Treatment. You'll then see the selected model's face displayed along with a legend for the amount of dermal filler to be used, along with the proposed injection pattern. Clicking Results shows a model with aesthetically ideal lips created by the proposed injection pattern and amount previously shown. Clicking the treatment plan will display the before model's face along with the proposed treatment and the after result, arranged side by side for comparison purposes. You can print, save, redo, or delete the treatment plan. After that, you can click either Another Feature, select another model, or restart that feature. So let's select another feature. In this case, we're going to look at enhancing the cheeks. Again, the patient chooses model number 1 as the closest match to their cheeks. Like before, if you need to show how to measure and evaluate the cheeks so that the patient can see exactly what it is that you're trying to accomplish, I can provide more information. Next, you can see the treatment and how the cheeks are going to be differently shaped from right to left. You'll also see the amount of filler needed to achieve the desired result. And then once again, you'll be able to view the treatment plan. We can then move on to another feature that the patient has selected for aesthetic enhancement and repeat the process. So now let's look at reducing unwanted lines and wrinkles using one of the various neurotoxins, neuromodulators. When this feature is selected, a legend is displayed showing the location of various lines and wrinkles along with some general information about each treatable area. When a specific area is selected, the patient will be asked to identify whether their lines or wrinkles in that particular area are mild, moderate, or severe. Or you'll be able to demonstrate each of these by rolling the cursor over each degree to assist the patient's selection. For example, this is what mild lines look like in a forehead compared to moderate or severe lines. In this case, the patient selects moderate. Selecting treatment displays the planned amount and injection pattern. You can then see the results of the treatment. Clicking the treatment plan displays the before treatment and after results, as well as the injection pattern. Naturally, at any time, you can ask me for specific information or a video demonstration to enhance patient education or provider training without ever leaving your place in the Consultation app. So now let's see how we can reduce folds. To demonstrate this, we'll return to the same face and legend we saw previously. This time, you can see the face with the relevant areas of facial folds numbered 7 through 10 and highlighted in green. When the cursor is placed over one of the highlighted numbers, either on the face or along the highlighted margin, the name of the fold is displayed along with pertinent information, and when you click on each fold, you see an example. As always, you can ask me to provide additional information or show helpful videos of consultations and actual treatments. By way of illustration, let's go ahead and click number 7, the nasal labial folds. A face with nasal labial folds before treatment is displayed. Clicking on treatment shows the suggested placement and amount of dermal filler. Clicking results reveals the before and after of the proposed treatment. And clicking the treatment plan will display a summary of the before, the treatment, and the final result. The same navigational points allow you to save, redo, or select another facial fold or an entirely different facial feature. Once you've completed the process of demonstrating the enhancement of all the facial features or areas the patient has selected, you can save or print out the various plans. This allows the treatment plans to be used as a guide during the actual treatment, as well as being incorporated into the patient's medical record. I hope you have enjoyed this demonstration. I'm confident you can see how useful this tool can be in increasing patient education and, as a result, consultation closure rates, making it a cornerstone of your education, training, and practice. I look forward to assisting you in using this consultation application, along with the entire Ideal Medical Aesthetics training platform. Your journey to aesthetic excellence as an elite practitioner starts here because nothing beats the ideal.